Hi, everybody. All right, I'm going to kick it off. I can see that number slowed down a little bit. I want to start by thanking everyone for being here Thursday evening before the May long weekend. So I know the scheduling of this one's a little bit tricky. My name's Chrissy. I'm the Chief Marketing and Membership Officer at the Canadian Physiotherapy Association. I'm going to be moderating today's session. During today's session, as most of you will know, we'll be hearing from both the CPA president and the CEO on the latest impact COVID-19 is having on the CPA and its members. In particular, we'll have the opportunity to answer some questions from you guys. As well, we've collated a nice big list of questions that we've been getting on a regular basis. We want to start by thanking everyone for the ongoing dialogue we've had with the CPA. It's been really meaningful, I know, for me to get to interact with and speak with members every day and talk to you guys about the things that are concerning you, the things that you need, all of those different pieces. So yeah, I just wanted to kick that off, and we'll use a combination of questions fielded through the Q&A portion of the webinar function, as well as I have some questions that we had submitted to information@physiotherapy.ca. Just for everybody attending, if you guys want to send a question, there's a Q&A bubble at the bottom of the Zoom thing. I know a lot of you guys have been attending our webinar, so kind of the same format. And to kick it off, we'll head it over to Vivi and let her say hi to everybody.
Hi, everyone. It's been crazy times. I just sent out another sort of update from CPA, and it's really a recognition letter thanking all of those people who have been so integral in helping CPA members get through this COVID crisis. And we specifically called out, divisions, branches, our researchers, industry partners. Also, Ortho Canada, which is a huge industry partner for CPA, has once again arranged for a CPA member-exclusive stockpile of PPE. So we're really thankful that we have these kinds of relationships. And anyway, we're here because there's so much happening right now. We are approaching our AGM, June 13th, Saturday, 12 noon Eastern time. I hope you all plan to be there. It's a virtual AGM, but it's an important meeting that we have every year. We just wanted to talk to our members, hear what questions you might have. You help us figure out what we need to do better at, or what we need to do, or what kind of support you need. So this is a chance to do that. So thank you for joining us. JP, I don't know if you want to add anything to that.
Yeah, I think I'm just going to piggyback on that a little bit, Vivi. We talk about CPA a lot, and we think ourselves as part of a bigger family. We talk about what we do within CPA, but what's happening with our partners and what's happening outside of CPA. You see what's happening with our partners through other health associations, the OTs, speech, doctors. There's a lot going on behind the scenes. You have our private sector partners like Embodia. You have our individual members like Mike Landry and Phil Shepard and Daryl Yardley, who are online constantly talking to and providing information to members on an ongoing basis that's helping them from day to day. And our regulators, our branches, as Vivi mentioned, there's a constant flow back and forth. There's such a complex environment and machinations happen on a day-to-day basis. Sometimes it's hard to keep track of, and sometimes it's hard to probably digest from a member perspective, but we're hoping tonight we can delve into some of those areas, clarify what's going on, and hopefully help in terms of next steps. So looking forward to the discussion.
Great. So with that said, the Q&A function is open. You can pass off any questions that you guys have for me. I think we can start off with one that's been a topic of interest for a lot of people, and that's about research. Obviously, COVID-19 is a flexible situation, and it's changing all the time. And there's been quite a few questions about how the CPA is supporting research in this period. So I'm wondering if one of the two of you would like to hit that one.
Sure, I'll start, and I'm sure JP may be able to fill in whatever gaps I leave. So Coincidentally, CPA has been working since January with the Canadian research community, who are working at arm's length from CPA to develop a strategic research plan. So we have a committee of researchers that are talking about where do we need to go in terms of research that will support the physiotherapy profession. So I'm really pleased that that project is underway. But also, we've had a huge number of physiotherapists have embarked on COVID and rehabilitation research. And so CPA has been receiving a lot of requests to disseminate surveys and information that will help researchers. Also, researchers internationally and in Canada have been pulling together guidelines on COVID care in acute and post-acute circumstances, and they're asking for CPA endorsement. And we're fortunate that we've got an incredible group of divisions with expertise in various areas. So we've really leaned on our division experts to help us review and determine, you know, is this something that we are happy to endorse? And so there's been a lot of work coming through CPA that has been really exciting to be a part of. So yeah, this whole process will continue.
One thing I will add on that kind of that research note and supporting the research that's going on, we do have on our website, there's a page where you can find current surveys that are out there for that research. So if you want to check out our website, that should be in the, I think it's in the COVID section, if I'm correct. So if you have a chance, check it out, fill it out if it's pertinent to you, and support your research community.
Awesome. Thanks, guys. That was an easy one to start. Not as easy of a question. We've gotten a lot of questions from members. I know this is one of the #1 things we're asked about from my team, from the membership team, is about business interruption insurance. Clinic owners are looking for information about what we're doing about the fact that the business interruption insurance clauses in the CPA's insurance policies don't seem to be triggering, and people are getting denials on those claims. I'm wondering if either of you can speak to kind of some of CPA's efforts with related to business interruption insurance.
Yes, I don't mind filling that one to start with, Vivi, if you want to hop in. Obviously, I do want to make some distinctions just in terms of information, because I know there's been a bit of misunderstanding of who's who. BMS is actually our insurance broker, so they work on our behalf. Novex, which is an Intact company, is the insurance company that has the program. So we have been working closely with BMS, monitoring what's been happening, providing, I think one of the first webinars we did was with BMS and Gowling, covering some of these topics. As Chrissy mentioned, we've received a lot of email and communication. We've had a lot of different discussions with, especially our clinic owners. And with that, we decided to go out and get a third-party legal review. A separate legal company we tend to use Gowling, which is our corporate firm, but they're also linked to Novex. So we hired Miller Thompson, which we have no connection, and there's no connection to the insurance companies we mentioned. And based on their review, they did confirm that there are under the program, there are actually no entitlements for CPA members under the current policies. Now, I think, Chrissy, you did actually also within that, we did go a bit further and ask, because we did get some specific questions around environmental contamination, right? And that was also one that it, as I guess with physical damages, but that's not covered as well. So right now, based on the feedback, there are no entitlements. Having said that, we're monitoring that on an ongoing basis. There are cases out there, both in the US and Canada, that are underway. If things do change, we will, with BMS, look at next steps and other opportunities if things do change within that area.
And I think I would just add that CPA can't tell any business whether or not to pursue a claim. That's a decision you need to make with your legal counsel. So we're trying to offer information for members to sort of help inform those kinds of decisions, but we're not in a position where we can say do or don't submit a claim. So just keep that in mind. It's really up to you and your counsel.
And just to reinforce, as I did with the surveys, we, for most of these like topics I think we'll be talking about tonight, you'll probably find information or statements again on our website, in our COVID pages. So if there's anything you want to go deeper or need more clarification or contact information, please feel free to check out the website.
Cool. So I've got a whole list here, guys, but I don't want to be the only one answering questions. So please don't be shy. Vivi and JP definitely want to hear from the members. But I can kind of continue on based on just so people understand my role. I work on the membership team, so we talk to members every day. And my team fields inquiries, and we put calls out for questions, especially at the end of our last webinar. We had quite a few questions come into Information Act. So we'll continue to use those, and don't be afraid to use that Q&A function, guys. I guess the next one, maybe if you guys could frame up the decision, both at the board level and operationally, for the CPA to release the member relief package initiative. Maybe speak a little bit to that and kind of what our objectives are for that project.
So I'll start again. This was a huge initiative that the board pushed very hard. We recognize that with a large majority of our membership are involved in private practice, and we knew that COVID required most of those practices to either close or reduce their operations to just, a fraction of what they used to be. So we really recognize that as we move into our renewal period for 2020, 2021, that there would be a lot of members who would be under a financial burden. So the board felt it was really important at this point in time to say, we're here for you. We want to continue to work with you, and offer them some sort of relief so they could continue to be a part of CPA and continue to benefit from the insurance product that we make available.
So let me provide some context. CPA is in a very enviable position based on its partnership with BMS. Typically or historically, a lot of these insurance programs that you'll get through an association, 100% of the profits go back to the insurance company. What happens in the case of our program is that in years of low claims, we actually receive a portion of the leftover funds. It's almost like a split with the insurance company. Those funds are put away into a reserve fund, a restricted reserve fund, for essentially member initiatives. And so we were able to, because of that reserve fund, the money has been generated over the years. We're able to apply that to the that discount, the 40% discount on the insurance program. So it's basically a member program that is being used for the purposes it was being used. It was meant to be used for. So the way it's set up this year, there will be a 40% discount on the insurance program that's paid for by the reserve fund. CPA is adding, and this is from CPA, this doesn't come out of the reserve fund, an additional 15% discount on CPA national fees if you buy upfront in lump sum. If you go month to month, there will be we'll waive the administrative fee on the month-to-month program. So it's meant to both acknowledge, recognize, support members in a time when we know that it's harder to pay these amounts. You already have your college funds, you have the association, you have so many other costs that are going on. We thought this would be one area where we could help out. So
great. One additional question we have here is, oh, sorry, my windows are all over the place. This actually came up earlier this week when BB, yourself, and a few board members were on the panel with the Cross Canada Checkup with Mike and Phil. There was some conversation about, what are some of the tactical things that are happening at the CPA and how is the CPA collaborating and working with its partners? And I know you guys all did a very good job of demonstrating that it's quite complicated, but I thought from an operational perspective, JP, if you had the chance to answer that question about how and what kind of collaborations the CPA is working through during the COVID-19 time and how those are influencing both the CPA's behavior and the profession as a whole.
Oh boy. I don't know where to start from that one. Let me start.
CLIA.
Well, yeah, if we go advocacy, if we start at the advocacy side of things, really there's ongoing work both at the CPA level and with our partners. So if I start with CPA, our new team we have right now, Barb Wright, our Senior Director of Advocacy, and Lisa Carroll, our Director of Policy and Research, are working with me, Vivi, and Chrissy, especially on the comms and the development of the messaging. We have been meeting with MPs, key ministers, Minister of Small Business, Finance, Health, Treasury Board, labor, all the programs that have been out, like CERB, CEWS, the rental program. We've been pushing for the last 2 months on not just getting them up and going, but also pushing to get and advocating for changes to help our members. We're currently working on getting in front of the House of Commons committees on health and finance. We've reached out to all the MPs on those committees. We're working with their staff. We've had a few wins. Some have quite honestly dropped in our lap, and one was the public sector health plan, where there's no longer a need for referral from doctors for public sector workers to see a physio. We were able to get that extended indefinitely, and we are in discussions with the government around making that permanent hopefully later in the year. We're also working collaboratively with, we're supporting branches in different areas. We've worked with Saskatchewan and doing a letter writing campaign. We're working with Nova Scotia, supporting them in some of the work they're doing with doctors. Obviously, we have ongoing work with what we call the Extended Health Providers Coalition, which is ourselves, OTs, social workers, psychologists, speech language, dental hygienists, and we've been looking at both working together on those ongoing issues. One being that we meet with the health minister every Tuesday to go through different topics from telehealth to mental health of frontline workers, to now looking forward and in recovery phase, knowing the importance of physio, OT, speech language, and psychologists in that recovery phase, looking at strategies and tactics we can use moving forward to get us front and center and recognized and in the right places at the right time. So there's a lot going on, and I think I just touched on a few. I know I probably missed some, but Evie, did I miss anything there in terms of the?
No, I think one of the things we're also looking forward to is during this whole COVID crisis, there's been a lot of position papers released internationally, and so much of it is focused on rehabilitation. So it doesn't always draw out physiotherapy as a separate profession, which I think is probably a good thing. I think that we are looking into a more interprofessional approach to rehabilitation. So I think we're going to be working a lot more closely with organizations like the CMA and the provincial medical associations, nursing, OT, of course, we're already engaged with speech and so on. So I think we're going to see more of that kind of collaboration moving forward, particularly now that the elective surgeries are going back online. And, I think we want to be able to leverage the voice of physicians because we're going to be able to help them get through their surgeries. So those are some of the plans in the works.
Yeah. And some of the work we're doing, I do want to say that, for example, and I didn't mention it a lot in the laundry list I went through, but with the insurance companies, like the Canadian Life and Health Insurance Association that we've been in discussions with, some of the work we've been doing with them in conjunction with the regulators, providing feedback on guidelines, telehealth, it actually is also helping us in terms of issues that we've been dealing with pre-COVID. So right now, CLIA has a group looking at issues around delisting. And we've been able to get to some of the stakeholders within those groups and at CLIA and have more robust conversations, more robust than we've had in the past, quite frankly. And I think partly because of the ongoing work and what's been happening with COVID and the I guess for lack of a word, the relationships and partnerships that are developing out of that. So there's the ongoing pieces that are happening now, but they're actually cementing a lot of those relationships to help us as we move forward with some of these bigger issues. Hope that helps. Did I answer the question?
Yeah, I think you did. I think it was a big one for sure. We're going to go to a couple of questions here coming in from the box. Love to see you guys participating there. One of the good questions we had from Phil was, what's the role of CPA during something like this? So who is leading rollout or guidance in Canada? Maybe some clarity about where the CPA plays in relation to some of those partners. That's kind of a follow-up from the last question.
I'm not sure I understand the question. What is the CPA role in this? So I think in terms of the physiotherapy profession, I think CPA obviously has a lead role to play. When it comes to collaborating with the other professions, we would take our share of the weight in collaborating with the other health professions. I'm not sure I'm answering that question very well.
Well, you know what? How about we use the example of like and this is maybe too much of an easy one, but the regulators versus the association in terms of, I think that's one where regulators do, they do focus on entry to practice. They do focus on guidelines, how the profession works, protection of the public. Whereas our role tends to be more in that advocating for the profession, promoting the profession, in a more external way, working with partners and so on. So that would be one area that I think that provides a bit of a distinction and a definition around what we tend to do in these times. And part of that is bringing those different players together as much as possible, especially if there's specific issues that we're trying to push.
Yeah, I think one thing that I would add, Phil has distinguished, it's our role in a disaster. I think what I would add is that it's important to understand that when it comes to public health and the government regulating public health at the provincial level, we don't have the ability or the scope to make recommendations, whether that's guiding on health, guiding on how practices should be running, what their guidelines should be. That is definitely the role of the regulator, just to echo JP's point. So it's about us working with those people and advocating behind the scenes to make sure that our members have the information they need from the people who are attached to public health and can make those decisions. So it's definitely supporting our members, often very much behind the scenes where people can't see that we're talking to the Canadian Association of Physiotherapy Regulators on a daily basis, or talking to universities on a daily basis to understand how their decisions apply to our members and make sure that the voices of our members are heard by those people when they tell us what their realities are. No problem. I'm just going to add to that I'm just going to follow up there. If the role of the regulator and the regulators are provincial, who is responsible for that communication on a national level? So there is an association or a regulatory group at the national level who represents all of the regulators, and that's who we work with. And then the regulators work with those provincial bodies. Thanks for the follow-up, Jenny. Another question from Jenny: what's our advice to members who are struggling to see their association alignment with government orders? So I think this is, again, just if there's any clarity we could get between what the CPA's role is in a disaster versus what the role is of the government in making those orders and where we're playing in relation to those. I'll click this so you guys, I make sure all my panelists can see it. There seems to be a gap in communication as members are feeling left out to dry. For example, the BC government announced their rollout and they haven't heard anything from the BC College yet. So just maybe if you guys could speak a little bit more to how we're working with the regulators and how we're influencing being influenced by public health.
Yeah, I think it's so critical to distinguish the power that CPA has or doesn't have, and we don't have the power to tell regulators what to do. Regulators are there to protect the public, and they have a legislative role to play. We definitely are engaged with them to talk about the issues, to raise our members' concerns with them, and in some cases, we've been able to influence their movement on various issues, but we don't have the power to tell them what to do. Our role as a professional association is to represent our members and offer support to our members when they need it. One of the questions that came up on Tuesday is, do we have a disaster plan? And we didn't have a disaster plan. We are planning to have a disaster plan going forward because this type of thing is likely to happen again in the future. But I think we represent our members. The more members we have, the stronger our voice in the national landscape. We don't necessarily have a strong voice provincially because we have to work with our provinces who have the relationships and the interactions with the provincial health ministries and the ministers and the bureaucrats in the provinces. So we support our provinces to provide them with information and materials that can help them in their advocacy efforts. But a CPA is unlikely to go to the Minister of Health in BC and advocate for changes in the BC health acts or regulations or services. So as a national professional association, we represent those members that are part of us. Our membership is 60%, over 60% private practice. So obviously we have had to deal with a huge number of business issues during this pandemic. That's what our members are coming to us for. We've been overwhelmed with concerns about keeping businesses going and the insurance coverage and the relief programs available to the governments. But as a national organization, we operate at a high level. We support our branches. We hear from our members what the issues are, and then we interact with our partners like the Canadian Alliance of Physiotherapy Regulators, the Canadian Council of University Physiotherapy Programs, and we essentially support each other. So CPA does not have an overriding role where we can just go in and change everything. And I think that's what is frustrating to many. Is it would be great if we could just go in and say, do this to the BC regulator, but we are not empowered or we don't, that's not our role to do that. So we're in a more supportive, collaborative role.
Thanks, Evie. I think it's important to mention too that that's legislated. The regulator's role is based in legislation. So as much as we can collaborate as possible within the rules of that law. Sandy has a question about just going back to the member relief package. Do we think the branches will also consider reducing their portion of the renewal fee, or what does it look like for branches integrating into that member relief package?
So again, branches are separate entities from CPA. So while we do support the branches and we communicate with them and we try to support each other, the branches have to make this decision for themselves. They have their own administrative structures, their own budgets. So we can't tell branches what to do in terms of their portion of the fees.
And in essence, what I would add to that as well, right? The insurance program is a national program, and that includes, we're part of that same family, CPA and the branches. So it's an extension of a benefit back to all members across the country, national and branch wise. And I think, I also think there's different realities. I'm not sure where they're all going to go, but also knowing that they come in different sizes and machinations. So their ability to do some of the, to kind of be able to provide some of those relief, that kind of relief might come in different ways than a discount on membership. So we'll see where that lands, but we can't, to Vivi's point, we can't speak for them in terms of their fees.
Great. Okay, we're gonna look at another question here that we had gotten from our email. The COVID system has or the COVID outbreak system, my apologies, has identified a number of gaps in our current healthcare system, specifically around vulnerable populations, Indigenous, seniors. What is the CPA doing to ensure the protection and treatment of these groups, and how do we see that looking moving forward?
I think CPA has been working closely with our Global Health Division, and we have an Indigenous subcommittee. I think this is an area we have to do better on, and I think we're working with the various partners that we mentioned earlier to look at ways to improve access to care for the underserviced communities. And I think this is part of the lobbying efforts that we're engaged in as well, trying to make sure that people who don't have access to physiotherapy are given some sort of advantage. JP, maybe you can speak to the student relief.
I think to Vivi's point, there's still, we'll be honest, there's still more work to do there. We have focused on rural and remote a fair bit. We did, coming into this, already have an ask around student loan forgiveness for PTs and PTAs who go to rural remote areas to practice. It would give them incentive to go. With what's been happening with COVID, for lack of a better word, it's always been there, but the emergence of telehealth, we're now adding advocacy around improving e-health technology and access in rural remote areas so that we can strengthen the telehealth tools and use of in rural remote areas. So we're building some pieces out, but we do have some work to do there.
Great, thank you. There are some questions about, I'm just gonna look through them here. For clinic owners looking to reopen, I think there's a few questions that we've had from the email, and there's a few in the chat. Specifically, like, who can people talk to? You can maybe talk about some of the things that the CPA is doing to support clinic owners as they reopen, as well as we'll sub-question this one because PPE is obviously top of mind when we talk about clinic reopening. So maybe we'll kick off with any guidance you would have for clinic owners who are looking for recommendations or who they can talk to about reopening, and then I'll take it from there.
Yeah, so we have a website that addresses a lot of those issues that clinic reopening raises. Our private practice division is doing a lot of work to populate that as well. Ortho Canada is a longstanding partner of CPAs, and they've just come up with another sort of stockpile of PPE that's specifically available to our members. So trying to enable our members to access that so they can open has been a big effort that we've been working on.
I would say that guideline-wise, most of that comes, bulk of that comes more locally, provincially, through your regulators, health authorities, within your work, whether it be hospitals or otherwise. So we do have lists of and links to a lot of those guidelines on the website, as Vivi mentioned. PPE, actually, Chris, I'm actually gonna punt that one over to you because you are working on that one full time. So,
okay, I'll take that one. Yeah, this is a thing the CPA has been working on a lot, and something I talk to Vivi and JP about a lot is, I don't ever profess to be a supply chain management expert. It's not my field, and it's not a field that after this I would ever want to get into. The geopolitical challenges, the access, and the pricing are all like completely different issues that are all very correlated. And what we're seeing is that a lot of our suppliers, or a lot of our distributors are paying higher prices from suppliers, which is making it look like our distributors are price gouging. Pricing on PPE is so volatile right now. It changes from day to day. We're seeing wholesalers come into the market and sell directly PPE instead of going through their Canadian distribution partners. So I know that there's a lot of skepticism in the community about what's happening with PPE and the prices and pricing of even of some of our partners. I think the thing that I would say is we're doing our best to ensure that we're in a bit of a no-lose situation. We can get access to product, but it's probably not going to be priced very well. Or we can also be advocating for pricing changes. And as in terms of association, we don't have very much influence on the supply chain, but we do have influence with the government. So we're working with the government to ensure that they can influence the supply chain and make sure that PPE is accessible. And in the meantime, our focus has been on how do we provide physiotherapists with access to PPE at the best price we can possibly get it. And that's what we've been doing with Ortho Canada. I think healthy skepticism is an important part of being a business owner, and I think that that's what we're hearing from a lot of the entrepreneurs who are running clinics who are concerned about the price of PPE right now. And what I would suggest is that a lot of the businesses, especially our partners, Ortho Canada, Performance Health, rely on their relationships with their physiotherapy clinic clients that pays the bills for them, and that I'm very confident, based on our relationships with them and the discussions that I've been part of, that those people are not willing to jeopardize their relationships with the industry in order to make a quick buck by marking up right now. And that the markups that we're seeing are really a supply chain issue that they just don't have control over. So we're working through this one as best as we can. To Vivi's earlier point, we did send out a new stockpile to enable people to have access as they go to reopen their clinics. And I'm speaking to business owners every day about this issue, and we encourage people on any of the issues discussed today to email us at information@physiotherapy.ca to make sure that we can provide you with the information you need.
Vivi, I'm sorry, Vivi, Chrissy, oh my God, I talked to you way too much. I'm not sure if this kind of links back to that question, but I also, on the other side of things, when it comes to reopening, some of the work we're doing around the Tomorrow campaign, building that awareness. Chrissy and her team hopefully you're seeing a lot of more stories around physiotherapy through the media. We're on the phone daily with national and local news outlets. We have a foresight group that's looking at what does this look like in 6, 8 to 12 months? How can we get ahead of next steps? So there's different things we're doing to try to help build awareness and B, look at what might be coming next and be prepared for it. So,
and just a reminder, our membership work to develop a strategic plan, and we're trying to continue to follow along the strategic plan as directed by members, and awareness and advocacy were the one and two issues. So we're trying to continue with those efforts during COVID. I just wanted to, there was another question from Phil about why not commit to having Indigenous representation within the CPA, apart from it being a subgroup. And I think that's a great segue into our governance review. Back in 2019, the board of directors felt that it was time to basically overhaul how CPA functions, how the board of director is constructed, how the president-elect and president are elected. And also we have some, our bylaws and rules and regulations haven't been updated in some time. So we are undergoing a full governance review. And that's the exact kind of question we want to address, is how can we do better in the areas of Indigenous representation? How can we, you know, do what our members need us to do and allow them input into what we do? So we are in the process of a full governance review, and I think that's an excellent point. It's on our agenda. We do have an external director opening that we're going to be discussing, I think, at the end of this month. So there are some opportunities to do that, but I think we need to build it, codify it into CPA, not just, you know, okay, we have an external director, let's bring in somebody with an Indigenous background, and we've already been warned about, you know, being careful that it's a meaningful role within CPA. So I think that's a really good question, and I think it's something that the board is considering very seriously.
Great. Maybe JP, there's a couple of questions that we're getting by email that, you know, I had included in my question list that related to the actions of our advocacy team. I think in the first few weeks, the advocacy team were very visible. There was a lot of things changing and meetings and letters going out. I'm wondering if you can speak to what the advocacy team's been up to for the last few weeks, while things are a little bit quieter from a member's perspective from the advocacy team.
Yeah, really, we're cementing those relationships. The advocacy side is still a bit new with the team. So both in terms on the federal side, as I mentioned a bit earlier, like the work behind the scenes in terms of getting in front of, looking at Vivi in front of sort of House Commons committees, building up next steps for us that we've been working on with the federal government. Behind the scenes work with CLIA. Specifically, we've had discussions with Sun Life and Grin Shields and other insurance companies in the background. The team has also been supporting the branches in some of their efforts locally. Again, I mentioned that a bit earlier. So there's a lot of things, both in terms of leading, building relationships, and supporting, that the advocacy team has been doing on an ongoing basis. So
I do have a follow-up. Can you speak specifically about telerehabilitation with insurers? That's a actually relatively new topic. We saw PPG's email yesterday address the fact that some insurers are starting to roll back their policies or have identified that they're not covering telerehabilitation after whatever date. I'm wondering if you could speak specifically to that.
Yeah, actually, that's an ongoing one. We've had a couple meetings. It's actually a joint meeting we've been having both with CLIA and Katya, who's the CEO at the Canadian Association of Physiotherapy. Alliance. I always do that. We've been working with them to, for lack of a better word, educate them on the role of telehealth, the importance of telehealth and how it fits within the system. So there are some changes that have been occurring on an ongoing basis and things have been going back and forth, but we are continuing that dialogue and trying to move things forward with the insurance industry. So it's a bit tough because you have so many different insurance companies that are doing their own thing. We're trying as best as possible, working with the national association to make sure that trickles down into those companies. So it's ongoing, but hopefully we're getting there.
Chrissy, I want to go back to a follow-up question Phil had about the strategic plan. So back in 2016, CPA undertook, or was it 2017, we undertook a strategic planning process that engaged all of the component leaders, our branches, thought leaders in physiotherapy, and a 5-year strategic plan was developed, and that 5 years is from 2018 to 2023. So right now, CPA members have already contributed to the current strategic plan. What the board is doing in terms of the strategic plan right now, we're revisiting it because we're at about the halfway mark, and we're going to have to consider what do we need to change in terms of activities to help meet our goals for the strategic plan. So we're in a process of strategic review, and Phil asks, what can members do? We don't have, as a board, we don't have the power to change the strategic plan without going back to the membership. So the plan doesn't expire until 2023. So we're looking at how can we refine and make the plan move forward for the next 2.5 years. But we're also going to start to look at the next strategic plan. We want to look 10 and 20 years into the future and try to have a vision of where the profession needs to go, and think about creating the strategic plan that would start in 2023. And as previously, that process involved feedback from the membership at large, as well as a very large, several hundred people from the leadership communities in CPA, the academic communities, as I said, thought leaders, researchers, and so on. So we'll use a similar consultative process when it comes time to build the new strategic plan. And if the board decides that it is time to make a change in the current plan, we would have to go back to members and seek input in order to have them enable us to make changes to it.
Cool. I think, first of all, thank you so much, Bill, because your questions have been really great and insightful, and you've been guiding a lot of this conversation, so we appreciate that. Let's finish off with, I think it's a good closing question here about when members look at renewal, what value the CPA offers. I think, the perspective was apart from insurance and division expertise. I think there seems to be a disconnect of the limitations we're describing in our ability to influence what the regulators are doing. And should members be looking for another association who has the ability to flex muscle a little bit more, who can advocate for direct PT a little bit more directly or more directly? I don't want to put a little bit into your question. So, from your perspective, BB and JP, what are members looking for at renewal? Why is being a part of the CPA, especially in a time like this, an important thing?
So as we've said, the provinces drive the healthcare agenda, and the provincial branches work with the provincial regulators to try to move things forward. And again, the branches don't have the power to tell the regulators what to do, but certainly there is typically ongoing communication about what the issues are, how best to address it. The branches are concerned that the regulators don't put in rules or guidance that's impractical. So there's ongoing exchange. Often the branches will come to CPA and look for resources and research and backup for policies and position. And I think that's, again, where CPA is, we partner with the branches, and the branches work with the regulators in each province to move things forward. Likewise, you may have a smaller branch with very few members, and they don't have the resources to have policy people or advocacy experts or legal guidance. So we will support those branches as well. Plus, I think being able to have the national overview means that one province can learn from another province, and I think we bring a lot of that together at CPA.
Yeah, I think what I'd add to that is, and kind of builds off that, is an association like ours is a bit different than the Alliance. I got the Alliance this time, not association. The CC Pups is that, either they're legislated or they work for a specific, group or niche within the profession. We have flexibility in that we represent the member. And because we're not tied to legislation or things of that nature, I think we're showing our value now in our ability to kind of work within government, work with at different levels, whether national or supporting branches, working with different partners, pulling that together with other health professions, or with the CCPOPs, with the capers, and that ability to go out there and speak for the member more broadly allows us to do a lot of different things that some groups can't do. And I think the proof is in the pudding in terms of some of the wins we've been able to get advocacy-wise, the work we've been able to do with private sector partners like Ortho Canada around PPE, bringing different groups together in terms of, our divisions have been a huge, that has been such a huge, I don't want to say win, but it's been such a huge part of what we've been able to do in terms of guidelines, expert advice, the webinars that are going on. That side of things, what we're able to do together is, I think has shown the benefit that having a membership or being part of CPA brings to individual members.
You know, it was interesting. We had a conversation with somebody from one of the major insurance companies in Canada, and he told us that insurers tend to rely on the regulators to explain what quality physiotherapy practice is. And we were able to explain to him that the regulators are there to promote a minimum standard of care, and that this is where CPA came in, because we're linked to the academic community, the research community. We understand the regulator's position as well. And I think a big part of our role is to elevate the practice and profession of physiotherapy. And that's what we're working really hard to do. And the other piece of what we do, of course, is the advocacy. And we work very closely with our branches who have the provincial voice at their disposal. So I think there's a lot that we're able to accomplish. But I think we're just sort of opening the door to a lot of these relationships with private payers who are paying billions of dollars a year for health and rehabilitation services. And we haven't really worked with them, helped them understand what we do. And we have made leaps and bounds in those relationships. And I think that's going to be very important going forward. And of course, we have to do that with governments as well. And, you know, we need the research to build the business case around why physiotherapy and rehabilitation fits in as a cost-effective or efficacious way of improving Canada's healthcare system. So I think it's sort of a many tentacled thing, CPA, but we need all of those tentacles because of the complexity of the Canadian healthcare system. If anybody thinks that you can have one body who's going to do everything that physiotherapists needs, you know, I would love to see that. So.
And as a word nerd, we're going to end on the use of the word efficacious, baby. Oh.
Oh, don't ask me to define it. Molly Berry was my supervisor, and she really.
Awesome. So we just want to take a second to say thank you to everyone who joined for the really insightful questions. For those of you who've been communicating with us at information@physiotherapy.ca, the membership team has been sending on those emails. They get to Vivi, they get to JP, they get to people like me or my colleague Elisa or Barb on our advocacy team. So we do really encourage our members to continue to reach out to us. We're making time for phone calls where we can and really making sure that you guys understand what your association has going on and what we're doing and what we're trying to do to support you. So really encourage you to continue to use information@physiotherapy.ca to get in touch with us. Just want to take a moment to thank Vivi and JP for their time this afternoon or this evening, and for everybody else for being here. And, you know, I think I'll end it with that. Anything else that you guys want to add?
Nope, just again, thanks to everybody. And I know there's hundreds of you in touch with us all the time, and we really appreciate that input. If we don't respond fast enough, I apologize, but we're really turning our wheels as quickly as we can. So please have patience, but we want those questions, suggestions, comments to come in.
It's great. Thanks, everybody.
Thank you.
Thanks, everybody.
Have a good night.
Night.